So in South Africa at this time, there is a huge competition for resources, and the organizations are doing fantastic work that needs to be done in terms of extending basic human rights to a large majority of South Africans that were excluded in the past. So despite the fact that our democracy and our new government is doing a lot to try and change the lives of the majority and the poor, the fact remains that there's still a large section of the population that the government can't reach and hasn't reached. So that then leaves the space for civil society to assist and support those communities, but also to advocate on their behalf. And that's why social justice organizations are very important in this context.
Campaigns are strategized and can take different forms, but usually involve a combination of mass mobilization. So usually that will take the form of sort of protest marches and mass meetings. They can involve media work. That can be through Facebook and Twitter, but also through releasing press statements and writing op-eds and letters to the editor. They involve also litigation at times and legal work. But our attitude has always been that we try to win campaigns firstly through political means. So through exercising pressure on government or business to do the right thing before resorting to legal action. Because we believe that sort of victories through community organizing and through political gains are transformative, and that they give people a real sense of their own power, and that they build accountability and capacity within government.
I think if you're wanting to engage in the social justice space, you have to be engaged in advocacy. You have to be agitating for change at a systems level. And groups need to be doing that closest to the ground. And so if to use the LGBT example, you had a situation where groups in the global north were often advocating around issues in Africa or all over the world. An Atlantic approach would recognize that you need to go to local communities at a very local level to advocate for what they think is important around LGBT issues. So not just taking on a global agenda. And I think for a global funder to do that is quite innovative, to say we're actually going to go right to the field and to local level, see what groups want, empower them to advocate on their own behalf, and it may or may not work out the way we planned. I think the appetite for advocacy is not there because you have to be in it for the long haul. It's messy. It doesn't happen overnight. Social change and advocacy is the most unpredictable course, and it doesn't fit neatly into a log frame necessarily. And I think most funders don't like that unpredictable nature. I think that's where we probably learn the most and where we probably have the most impact.
I'm most proud of the work that we've done with the LGBTI community. I think it's had a real impact on that community. It's been very inspiring to see the growth of new organizations, to see young black, gay and lesbian people beginning to organize and take control of their lives. And then on the legal front, in terms of the constitutional victories that the movement has won, LGBTIs in this country formally on paper have full citizenship, which is remarkable in a world where that is mostly not the case. That's not to say that there isn't homophobic violence, that gay and lesbian people are stigmatized, but we've come a long way. I think, in effect, in South Africa, we have leapfrogged, because of the Constitution, what it took gays and lesbians in other parts of the world 20 years to achieve.
Today, I wouldn't be having my second child. And I'm having this child. It's possible because of that prevention of mother-to-child transmission program. But it didn't just come without a fight. It came because we fought and insisted that government provides AZT and nevarapine to all pregnant women in South Africa to prevent transmission of HIV from mother to child. First, to assert the right that the mother has a right to have a child, that's negative. And that right is enshrined in the Constitution just on its own, sexual reproductive rights. The second is the right to life. Me as a mother, that I need to be alive for my child to make sure that my child, when my child is born, I'm still alive. So making sure that I also get access to treatment to be alive for when the child is born. And unfortunately, our government didn't embrace that. We had to go to court. We went as far as the Constitutional Court. And the Constitutional Court ruled in our favor that government must provide adequate health services, especially for women, to ensure that women are given nevarapine and AZT to prevent mother-to-child HIV transmission.
You know, when we went to court over preventing mother-to-child transmission in 2001 to 2002, 30% of pregnant women who had HIV would transmit HIV to the child. That meant about 300,000 HIV-positive births per annum. And most of those children would die in those days. Today, after a decade and more of sustained pressure that started with winning a court case, 30% has been reduced to 2.7% of pregnancies where the mother will transmit to the child, which is just a massive reduction. You know, people are now talking about the elimination of mother-to-child HIV transmission, and that's possible. And it's hard to believe that to get to there, we had to start with this fierce, bitter fight, demonstration, court cases, and so on and so on. But we're there. You know, in our constitution, and the constitution is the touchstone of all of our work, the constitution says everyone has a right of access to healthcare services. But the constitution is not self-enacting. You know, just because it says that doesn't mean that the person out on the street here or in the rural areas or wherever in South Africa gets delivered of access to quality healthcare services. It takes a struggle. It takes a struggle to get quality. It takes a struggle to get the provision of basic healthcare services. And what the AIDS Law Project has done is really to organize that struggle from the perspective of access for poor people. So, you know, Atlantic has supported us over the years with core grants and some programmatic grants that are really very much about how do you enhance access? How do you use the law to ensure that people get access to healthcare services?
You know, most foundations in this country, all foundations in this country, have assets that are under management and they are invested in shares. And so we are starting to talk about using our collective strength as foundations, some of whom, in fact, most of whom are not involved in social justice, but looking at our portfolios and saying, where are our investments? And actually, can we use our combined muscle, financial muscle, to advocate for the corporates to behave better, and to, you know, in terms of, you know, governance, in terms of, you know, the salary disparities between the CEOs and the workers, or environmental factors, etc. So I think there's lots of potential out there. There's more potential, I think, in terms of the social justice sector to do advocacy work, but there's also potential just as foundations for us to work in areas that we have common, where there's common ground. Because I think most foundations in this country should be, and many are, concerned about where they are invested. And especially in the recent case of Lawnman and the Marikana crisis, people started to worry about whether they were invested in Lawnman and how that would look. And I think that's positive. So I think there's lots of potential for advocacy, and I don't think we've really explored it enough. But there are constraints. Well, we don't have enough South African foundations that are working in social justice.